Hello and welcome to this video about blood pressure. It's a really important topic and yet sometimes underestimated. You've likely had many blood pressure readings taken in the past, probably most times in a clinic. But I wonder, do you understand why it is important? In fact, do you know what your readings have been in the past or what they might mean? Is this something you want to know? There is some evidence that monitoring your readings can lead to improved results. So to explain blood pressure, we first need to understand what our circulation system is. Our circulatory system is a network of tubes that take blood throughout the body. We could compare our circulatory system to a network of roads, the motorways being the large vessels or tubes, and these motorways feeding into A roads. This network of blood vessels carries our blood throughout our body to our heart, our lungs, down to tiny little blood vessels in our eyes and our feet. As blood travels through the blood system, it presses against the walls of this network of tubes. And just as roadworks can cause traffic to build up and put pressure on the road system, so too can the build-up of fatty deposits on the inner walls of the blood vessels cause pressure on the blood or circulatory system. So essentially, blood pressure measures how hard the blood is pushing against the walls of the blood vessels. Let's look at the numbers together. You've probably heard your blood pressure expressed as two numbers, maybe written like this: 120/80. The first or top number relates to our systolic pressure. That's when your heart pushes blood out at the maximum pressure, when your heart is needing to work as hard as it can to pump blood around the body. So this is the highest reading or top number. The bottom number relates to the diastolic pressure. This is when your heart is at rest and just pumping normally, so it's always a smaller number because your heart is resting and more relaxed. So what levels or numbers are good? Generally, a person living with diabetes would be advised to aim for levels below 140/80. However, if you do have other health problems or a history of stroke, heart attacks, kidney disease, you may be advised to have lower targets of 130/80. If you have a question about your individual target levels or blood pressure, this may be something you want to discuss in your next healthcare appointment. It is really important to keep an eye on your readings. The reason being, for most people, they are unlikely to have outward signs if their blood pressure is consistently high. And yet, if it is, your heart is having to work harder to pump blood around your body. This puts a lot of pressure on your heart, but it also puts pressure on the tiny, small blood vessels that feed your eyes and your kidneys, causing them damage. High blood pressure is something to take seriously, which is why it's referred to as the silent killer. However, the important thing is not to ignore it, and if you and your GP or nurse are looking at ways to manage it, you are in it together. So if you do have high blood pressure, sometimes medication is needed to manage it. But here is also the good news. It's human nature that we all want to try and control things ourselves where we can. There are a number of lifestyle changes you can make to help put your blood pressure in the right direction, or maybe control it. Making small changes to lose some weight, eat less salt, reduce your alcohol intake, stop smoking, or to become more active can really make the difference. At Learning Zone, we are not saying that making wholesale lifestyle changes are easy, and we're not saying you need to tackle the whole list. However, what we are inviting you to do is to look at these changes and think about any of these you feel you could work on. Come and visit our courses such as Food Hacks or Moving More. We would love to see you again at Learning Zone.